A new fleet of more than 300 vehicles for transporting suspected COVID-19 patients who are clinically well, is now on the road. The Health Ministry says the non-emergency fleet will complement existing ambulance services, and they are reserved specifically for activation by the ministry. Geraldine Yap reports.
39-year-old Roy Lee has been with Grab since 2015. When the call came last month for volunteers to ferry suspected COVID-19 cases, he didn't think twice. More than 3 weeks into his new role, Roy says he's so far responded to about 40 calls.
When we get the call, we gear up in our mask, in our gown and gloves, plus our goggles. Then we proceed to the pickup point, which is usually clinics or dormitories, which has activated the MOH hotline. After that, we'll just drive on to wherever they are supposed to be dropped off. Usually it's either NCID or SGH, where they have a specialized demarcated area just for us to let the suspected patients with COVID-19 alight, where the nurses will be there to receive them.
Roy is part of a group of more than 300 drivers from Grab and SMRT subsidiary Strides Transportation. Their role is very specific: to drive persons who are stable and clinically well to hospitals. These include suspect COVID-19 cases and those on stay-home notice. MOH says suspect cases assessed by doctors to be clinically unwell will continue to be ferried by ambulances. This non-emergency transport service runs round the clock, and the drivers work 8-hour shifts. When off duty, they do not pick up other passengers. CNE understands they'll be paid a fixed amount every week. Before being deployed, all drivers are trained on medical and safety protocols by the Singapore Civil Defence Force.
This is to ensure they know how to protect themselves as well as the passengers. The drivers must also wipe and disinfect their vehicles after each trip. They can collect the supply of PPE, sanitizers and wipes at the designated central location.
Drivers also use the same equipment as ambulance operators for infection control and follow the same decontamination procedures. When asked if this new fleet is an indication that Singapore's healthcare capacity could be under strain, one expert says it's more a matter of the government being forward-thinking.
What the Ministry of Health is doing is really repurposing and thinking out of the box. We have seen this repurposing happening at Expo. Military doctors are being recalled back to actually look after COVID-19s in the Expos. I've seen people who volunteer who are just guest relations coming down to be nursing aides to these people. And similarly, looking at how we do ambulance transport, by simply providing a little bit of education, we value add so much more to the driver.